Doctors today have access to amazing technology to help them diagnose and treat patients, from ultrasounds to MRIs to blood tests. But over in the Middle Ages, things were very different. Some of the treatments doctors used may seem bizarre, cruel, and even disgusting to us today, but they were standard practice for centuries, and they were often used to treat some of humanity's most terrible afflictions. So today we'll explore 20 of the strangest medical practices of the Middle Ages. You won't believe no. 1. First off, let's talk about bloodletting. This was the most common medical practice during the Middle Ages. They believed that every living thing had four humors inside of them: blood, phlegm, black bile, and yellow bile. They believed that when one of these four was out of balance, it would cause illness. So doctors would need to remove some of the bad humor to restore balance to the patient's body. Now, bloodletting can be a good thing. We use it today to save lives in emergencies and treat serious conditions. But in the Middle Ages, it was used for everything. If a woman had a fever, bloodletting would cure her. If she had a headache, bloodletting would take care of that too. There was no condition that bloodletting couldn't fix, according to medieval doctors, and they would use whatever method necessary to drain their poor patients. But the weirdest part was how they would drain this bad blood. They would use leeches. Leeches are blood suckers. That's what they do. And doctors would apply them to specific points on the body where they believed the bad blood could be drawn out. Next up is uroscopy, which is the visual inspection of urine. Urine, according to medieval doctors, could tell you everything you needed to know about a patient. How did they diagnose someone? By looking at their pee. They would examine the color, the smell, even the taste of the patient's pee to get a sense of their overall health. And don't think that was a quick sniff either. Doctors would dip bread in the urine to make it easier to taste. Yummy. Now, not all medical procedures were painful, but many of them certainly were. Trephination involved drilling a hole into the skull. Now, why would anyone want to do that? Well, because the medieval medical community believed that many mental disorders were the result of evil spirits trapped inside the head. So if someone was depressed, having mood swings, or just acting a little weird, they might be possessed by an evil spirit. And trephination was the surgical procedure to release those evil spirits. The idea was that if they could release the spirits, then the patient would be cured. Sometimes they would do this to relieve pressure in the brain as well. But that didn't become common practice until the 18th century. This surgery was brutal and would often be done without any form of anesthesia. Surgeries of all kinds were not performed by doctors, but by barber surgeons. These guys cut hair for a living, but when they weren't giving people haircuts, they were performing amputations, removing tumors, and doing all sorts of other nasty stuff. The problem with barber surgeons is that they didn't really understand sanitation. They wouldn't wash their hands before operations, and their tools would be covered in blood and other nasty stuff. Barber surgeons were a necessary evil during the Middle Ages, as regular doctors wouldn't perform such dirty work. But regardless of who performed the surgery, there was one thing that never changed. All surgeries were performed with the patient wide awake. As we mentioned earlier, medieval doctors believed that all illness was the result of an imbalance of the four humors. which they called the theory of the four humours. Now, these humours were blood, yellow bile, black bile, and phlegm, and each of these was associated with a particular season. Blood was spring, yellow bile was summer, black bile was autumn, and winter was phlegm. This theory of the four humours was the foundation of all medieval medicine. Every decision a doctor made, every prescription they wrote, was based on this theory. If a patient was ill, it was because one of their humours was out of balance. To treat them, the doctor had to rebalance these humours so the patient could be well again. And what better way to rebalance the humours than with mummy powder? Wait, what? Yes, you heard that right. Mummy powder was a popular medicine during the Middle Ages. They believed that the ground-up remains of ancient mummies held powerful healing properties and could cure a variety of ailments, from epilepsy to ulcers to broken bones. The powder was made by grinding up the bones of mummies that had been dug up from cemeteries, and it was highly prized by apothecaries. It wasn't until the late 19th century that the use of mummy powder finally died out. Amputations were done without anesthesia, meaning every patient was wide awake when their limbs were chopped off. But that wasn't the worst part. After the amputation, the stump of the limb would bleed profusely. The only way to stop the bleeding was through cauterization, where a hot iron would be used to seal the wound. This was obviously a horrifyingly painful process, but it was necessary to prevent the patient from bleeding to death. People in the Middle Ages believed in something called sympathetic magic. This was the idea that if you had a cut on your hand, you could treat it by putting a piece of bread on the knife. That cut you. They thought that by treating the weapon that caused the wound, you would transfer the cure to yourself. How crazy is that? During the Middle Ages, herbal remedies were popular. Herbs have real medicinal properties and were used to treat a variety of ailments, from headaches to stomach aches to fever. But many herbs were also used for their supposed magical powers. For example, henbane was used to treat headaches, but it was also believed to be a powerful witchcraft herb. Rosemary was used to treat nausea, but it was also believed to improve memory and protect against evil spirits. Now, this next one sounds absolutely insane. But people in the Middle Ages would use all sorts of bizarre substances to treat illnesses and wounds, from powdered pearls to spider webs as bandages. People would try anything if they thought it would help them get rid of a fever, a cold, or a broken bone. One of the more common substances used was animal dung, specifically the dung of cows, horses, and pigs. Dung was used to treat everything from cuts and bruises to more serious injuries, like broken bones. It was also used to treat a variety of illnesses, from fevers to stomach aches to even childbirth. The thinking was that since dung was produced by animals, it must have some sort of magical power over them. In addition to using bizarre substances themselves, doctors and apothecaries would also use bez or stones, which were calcified masses found in the stomachs of goats. Apothecaries believed these stones were a universal antidote to poison, and they would sell them as a cure-all for everything from snake bites to food poisoning. Of course, they had no real power over poison, but people kept buying them anyway. Now, during the plague, doctors would wear a distinctive costume while treating patients. The outfit consisted of a long, loose gown made of linen or leather, along with a distinctive beak-like mask filled with sweet-smelling herbs. The reason for the mask was that they believed the plague was spread by foul odors. So by wearing a mask that smelled like roses or camphor, they were protecting themselves from the disease. Unfortunately, this didn't actually work, and many of these doctors ended up dying from the plague themselves. Back in the Middle Ages, the influence of the planets and astrology was a crucial part of medical diagnosis. Before performing surgery or administering a treatment, doctors would consult star charts to determine the best time to do so. This was because they believed that the positions of the planets and stars could affect a person's health and well-being. They also believed that certain days of the week were better for certain types of treatments. For example, they believed that the best day to perform surgery was on an even day in an even-numbered month. Toothaches were a common ailment during the Middle Ages, and the most common remedy was extraction. This was usually done by a blacksmith, of all people, and involved using a pair of pliers to pull the tooth out. Obviously, this was a very painful and often dangerous procedure, but it was the best option available. Back then, the idea of Novocaine or any other form of anesthesia hadn't been invented yet. One of the most unusual aspects of medieval medicine was dream analysis. Some physicians believed that a person's dreams could reveal the underlying cause of a physical ailment. For example, if a patient had a dream about being chased, this might indicate that they had a fear of losing control, which could manifest itself in physical symptoms. To treat this, they would perform a bloodletting ceremony while the patient was asleep, and then give them a potion to help them forget about the dream. During the Middle Ages, people were often seen as being sick because they were a punishment from God or possessed by demons. As a result, their treatment would often involve prayers, exorcisms, and public penance. For example, if a woman was accused of being a witch, she would be forced to drink a potion made of the ashes of a dead cat and then parade through town, with a sign around her neck declaring her guilt. Now, let's talk about a popular but incredibly dangerous practice, the use of mandrake root. Mandrake root was used as an anesthetic during the Middle Ages, but it was also hallucinogenic and toxic. Many patients died from using it, but that didn't stop doctors from trying it. And believe it or not, during the Middle Ages, some doctors believed that a patient's blood and urine could be used as medicine. That's right. Urine therapy was a thing back then. They believed that consuming another person's urine could cure a variety of ailments, from kidney stones to urinary tract infections. They also believed that urine could be used as a topical treatment for skin conditions like eczema and psoriasis. So there you have it, 20 of the strangest medical practices of the Middle Ages. Which one surprised you the most? Let us know in the comments below. And if you enjoyed this video, be sure to check out our other content.